Hello, my name is Devin Hanton, and today I'm going to present the procedure of gastric lavage. Gastric lavage is used only in certain instances when the patient comes to the emergency department within 1 to 2 hours of ingesting a toxic and lethal dose of a harmful substance, which in addition to that can also have limited therapy. For example, if a patient comes to the emergency department and ingests a substance or a medication and we do not have an antidote for it, we will be doing gastric lavage. This is not very widely used as much due to the complications. The best thing to do if a lethal dose of a harmful substance is ingested, the best thing to do is to contact poison control. The materials that you will need include IV access, suction, intubation equipment, large bore OG tube. For adults it will be 36 to 40 French, and for a child it will be 24 to 28. An NG tube can also be used if the medication or substance ingested is a liquid. Jelly lubricant will be needed for insertion. Warm normal saline or warm water, except warm water cannot be used for pediatrics. 50 grams of activated charcoal will also be needed. The procedure is done if the patient is awake and alert, then you will not need to use intubation equipment if they can protect their airway. If they cannot protect their airway, then you will need to intubate before this is done. After that, you ensure the airway is secured. You're going to, here I have my patient here. This patient cannot protect their airway, so they are intubated. This is going to be the ET tube. You're going to measure from the mouth to the stomach with the OG tube to ensure the length can reach the stomach. You are then going to insert the OG tube. After you insert the OG tube, you will need to complete an X-ray or get your stethoscope and insert air to listen for the placement. After you ensure placement is done, you will prepare to do the gastric lavage. You are going to position the patient on their side and with their head down. The reason we put them in this position is to help prevent aspiration, which is the most common complication. I forgot to mention, when you insert the OG tube, you must be gentle and insert it slowly because you do not want to cause esophageal perforation. This is another complication. After you place them on their side and insert the OG tube and ensure placement, here's my large syringe. We are going to insert 200 to 300 mLs of normal saline. You are then going to aspirate that and get rid of it. You are then going to do this multiple times, putting in the 200 to 300 ml and aspirating until the fluid that you aspirate is clear. When you are done with this, you are going to administer through the OG tube 50 grams of activated charcoal. The reasoning for this is to ensure that more absorption isn't done by the harmful substance or medication, or absorption isn't continued by your body in the small intestine, so the charcoal will be administered to help prevent further absorption. After you're done administering the activated charcoal, you're going to gently remove the OG tube. Contraindications of gastric lavage include resuscitation incomplete, if an antidote for ingested medication is available, for like the example I gave earlier, if they come to the emergency room and we have an antidote, gastric lavage is not needed. Other contraindications include hydrocarbon, history of gastric bypass surgery, large pills ingested that cannot fit through the OG tube, late presentation of toxicity, so if they present after 4 hours of ingesting the harmful substance, and presence of an intestinal obstruction. Complications include incomplete decontamination of medication or poison. An example of that would be if the ingested medication causes for gastric lavage and we finish the gastric lavage, a complication could be that we didn't completely get the poison or medication out. Other complications include pulmonary aspiration, hypoxia, laryngospasm, medical injury to GI tract, and water intoxication. Mainly this is in children because water can cause hyponatremia. That's why you must use normal saline. This procedure is performed by a doctor or the emergency physician available. The nurse's role is to help set up with supplies, document during the procedure, and administer any medications that may be needed, such as analgesics or sedatives. After the procedure, the nurse will monitor vital signs and further observe the patient. If the patient cannot protect their airway, or even if they can protect their airway, you will look to see if they are alert and oriented and further observe their neurostatus. Because of the administration of activated charcoal, you also want to observe for nausea and vomiting. This can occur because of the charcoal. Specifically, the activated charcoal, because we administer 50 grams, it can be a lot on the patient when it's going through the GI tract. Other things the nurse will be doing after the procedure is to look for signs of aspiration. Because this is such a common complication, we must ensure that we are monitoring for it. An X-ray may be needed after to ensure the ET tube placement is still correct. Common mistakes include misplacement of the OG tube, an incomplete removal of substances, and aspiration. That concludes my presentation for the procedure of gastric lavage.